Look, wanted to talk to you today about a patient that I saw today, and actually talked about this patient in our Zoom call with the membership today, and want to gear this, so going to gear it a little bit differently towards you people because most of you haven't been in the shift. So I'm going to talk to you as either students or clinicians who are figuring out that the path you're going down is not the path you want to go down, that it's not what you thought it was going to be, and how you know. So what is the litmus test to alert you to what you're doing is not working? And if you already know that, but you're trying to do things differently, so maybe you're trying to implement some of the things that you've seen here in this group or on reels that I've posted, that kind of stuff. And you've got people that you're working with or students in your class, if you're going through a grad program, that are asking you, why are you doing that? And why aren't you just doing what everybody else is doing? Okay. So this is a test that you can give them. Okay. So here's the scenario. So a patient came in today who I originally started seeing probably 2.5, maybe 3 years ago, had a pretty severe injury. She actually fell through a hole in the floor of her employer. She was working at like a hair salon that was in a really old house, and they left the trap door that goes into what was the root cellar in like the 1800s. They left the trap door open in a room with the light turned off. So she walks into the room not knowing there's a hole in the floor. She falls through the hole in the floor, lands on her ankle on one side and a straight leg on the other side. Needless to say, she's got some injuries from that. Luckily, she didn't break anything. She didn't break her ankle. She didn't break her femur or anything like that. But she ended up with a pretty significant bone bruise. What we're finally figuring out might be some fissuring of the patellar plateau, some meniscal damage. So when she came to me, she just moved here from Wyoming where she was living. And she was working with one of our 180 practitioners in Wyoming. So she looked me up when she got here and said, hey, you do 182. I want to see you. So fantastic. So first time I saw her, she was walking on 2 crutches, very limited weight bearing, just because she was in so much pain. And this was probably like 6 months after the injury. She had gotten totally screwed over by her boss, who didn't let her file, made it sound like everything's under control. I'll cover everything. Don't file work comp. We'll get it taken care of. Then basically cut her loose, and she had no work comp claim to file because I don't know what happened with work comp. She waited too long, whatever. So, not able to work because her job is standing, doing hair. Pain all the time, swelling all the time. So she comes to see me. I'm not too sure from what she's told me that I'm going to be able to do much. So this is one of the messages that I gave people in Zoom today. Even if you think you can't do anything, move forward with the plan. So if you're doing 180, move forward with the plan. Doesn't matter what they say, do it and see what happens. So I was pleasantly surprised that she responded really quickly. So she was off of crutches, off of a cane, normal weight bearing, walking with pretty decent gait after 2 times with me. So fantastic results, better than I thought she would be. But as we progressed over several months, probably over the span of a year, went from seeing her twice a week to once a week to every other month. I think by the time we got to early last winter was the last time that I saw her, we were at like once every 3 months. Now, she still wasn't happy with her progress. She still couldn't do things that she wanted to do. Knee still blew up at the end of an 8-hour shift, standing on her feet all day, that kind of stuff. So she sought treatment. She sought a second opinion from a different doctor. Came in and said she was thrilled. She met this guy. He has a real plan. I was like, fantastic. Tell me what his plan is. Tell me what his name is. So she told me what his name was, and I was like, oh shit, this is one of the shotgun treatment docs, alternative medicine guys who has every form of wave therapy, light therapy, vibration therapy, injection therapy, cream therapy, tape therapy, brace therapy, all this crap. And I knew exactly what he was going to do with her. And that was probably like September, October, like last time I saw her. So she came in today after not seeing me for a while. I said, how are things going? She said, well, I'm still seeing the other guy and we're still trying to figure out what's going on. And I said, okay, so you're still not any better than you were last time. And she said, no. And she said, well, I did get a hysterectomy, so I was off of my feet for a week to 10 days, and I felt fine then. And I said, okay, and how soon did symptoms come back after you went back to work and resumed normal ADL? And she said, oh, by the time I was on my feet for the first 4 to 6 hours of the first day back, everything came back. And so this is where I thought we would be. So I said, okay, what are you doing with the guy who's doing this stuff? And she said, well, we're still trying to figure out what's working and what's not working. And I said, okay, so, and he's trying different things every time you go in there. She said, yeah, every time I go in, it's a different combination of things. And I said, and every time your symptoms come back an hour after you leave. And she said, yeah. I said, okay, so now what I didn't tell you is she's extremely emotional. So telling her when I was seeing her last time, hey, it's time to just come to terms with the fact that your knee is effed. And in my opinion, from what I've seen, your clinical presentation, the amount of injury that you had to have sustained, even though your old imaging said possible bone bruise and that was it, I think it's time to take the next step. I can't help you. I'm glad that I helped you like feel better for a month or two before you had to come back to get tuned up. Doesn't seem like this guy's giving you more than a half an hour and you're paying him cash for basically using you as a science experiment for things that I know aren't going to work. So I was crossing my fingers when she saw this guy, hoping she'd get some kind of placebo effect. Didn't happen. So I finally had to say, hey, we're gonna have our come to Jesus talk here. You, in my opinion, from what I've seen, and from what I know is out there treatment strategy-wise, I don't see anything short of a total knee for you. And I hate saying that because she's only like 35 years old. So she was like, so you think that's what it is? And I said, yeah, I think and she finally got updated imaging. Imaging showed a bone bruise. So we're 2 years after this injury and she's still showing a bone bruise. I said, I bet there's more than a bone bruise. I bet that your meniscus damage is more significant than what this is saying. And the last 2 years of history proves that you're not getting anywhere with me or with him or with anybody else. So it's time, I'm gonna send you to a good surgeon, get an opinion from him, tell him the whole history so they know how long you've been putting up with this, how it's not responded to anything, and see if they agree with me that it's time for a total knee. So here's the point for you guys. If you are like this guy that's doing all these different things, so if you have a patient that's coming in and you're trying a different thing every 1 to 3 visits, you give cupping a shot for 3 visits, doesn't work. Okay, let's change it up. Dry needling for 3 visits, doesn't work. K-tape for 3 visits, doesn't work. So if you're doing that, that can only mean one of 2 things. You're either in this situation that I'm with her, where she has mechanical damage to the weight-bearing surface, because she said, well, this other guy said, well, the next thing is to try PRP. I said, PRP is not going to do anything to a weight-bearing surface. Period. Stop. Don't waste your time. Okay? So if you have a mechanical issue that you can't get past, that would explain why you're yo-yoing back and forth and shotgun approach to get rid of symptoms that's not working. Or you're never, and kind of the same thing, and you're not getting to the root cause. So her root cause is she's got damage. She's got something going on that weight-bearing surface that we're not gonna get over. In your situation, if you're dealing with low back pain, ankle sprain, shoulder impingement, plantar fasciitis, whatever, and you're trying all the different strategies and nothing is working, it means that you're not getting to the root cause of their problem, because it's probably not a mechanical or structural deficit when you're dealing with impingement or plantar fasciitis, idiopathic low back pain, something like that. So the more you grab at different things, and the more, if you stand back and look at what you're doing, the more you realize that you're chasing pain, swelling, lack of range of motion, tightness, symptom, that means you're not getting to the root cause. That means it's time to stop and change your treatment strategies and, more importantly, your thought process. Because if your thought process is their diagnosis is, their special tests were positive for, their imaging said yada, 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 that means you have not done the hard work to get to the root cause of the problem. So if you are doing that and you are experimenting with strategies that you see us doing here, and your coworkers or your professors or your boss or your classmates ask you, why are you doing that? Why don't you just put K-tape on it? Why don't you just do E-stim? This is what you would say. You would say, well, if I did that and it didn't solve the problem, and they came back and had the same problem, what would I do then? And then they would say, okay, well then go to this symptom modification strategy. And then you'd say, well, if I did that and they came back and they still had it, then what do I do? Oh, well, then you go to this symptom modification strategy. Now, they don't think it's a symptom modification strategy. They think it's great treatment because they saw somebody else do it on social media, in the clinic, at school, whatever it is. Okay? So, take-home message. If you are noticing that you're doing multiple different treatment strategies to treat similar symptoms, whether that's in the same patient repetitively and then changing the strategy, or you're doing this strategy for this patient for low back pain and you're doing that strategy for that patient for low back pain, and you don't know why you're doing two different things, and you sit back and realize they're both symptom modification strategies, then you know it's time to stop doing what you're doing. It's time to take a step back, figure out why you're lost, why you're confused, why you're chasing symptoms. All of that is going to go back to, you didn't learn how to be a clinician in PT school. You didn't learn how to apply neuromuscular physiology. You didn't learn critical thinking. You didn't learn root cause analysis. You don't understand the progression to injury, which is why you're stuck chasing symptoms. And if you figured out that, but you're talking to whoever you're talking to, you have to say, this is what you're doing. You're going down the protocol, the diagnosis-specific treatment, whatever, to treat symptoms. Okay? So keep that in mind. When people question you, if you're doing different things, if they question you why you aren't doing the other things, ask them what the other things do. And when the other things fail, what's the next step? And if it's not, well, take a step back, figure out what this patient is presenting with, not what their symptoms are. What are they presenting with functionally, and what are they presenting with on a neuromuscular basis? That's what you need to figure out. Otherwise, you're still effed, you're still going down the wrong road, and you're going to continuously reach for crap that's not going to work. Your patients are going to, now think about it. Now you're sending a patient that you could have easily fixed in 2 to 3 visits had you had the knowledge that they didn't give you in school. You could have fixed that patient. You can't fix them. So now what do? They go to the chiropractor. You think the chiropractor is going to help them, or screw them over with a $2,500 package? Or they're going to go to the physician that only knows how to do surgery, or put them on pain medication, or give them injections. That's not going to work. So now you just multiplied this person's problem because you as a clinician were not prepared to be in the position that you're in. And now you're understanding that. So be a responsible professional and figure out how to do a better job. And when you want to know how I can help you do a better job in 4 months so you can wipe this whole conundrum off the page, you can stop doing this crap, you can tell people this is what I'm doing, this is why I'm doing it, and you aren't going to help those people doing what you're doing. I already know that because I did the same thing that you guys did and it didn't work. When you're ready to do that, let me know.